I'm going to talk regarding complement gene expression and biodistribution of complement proteins in the synovium from early rheumatoid arthritis patients. We have shown that subjects with active RA and ongoing joint inflammation show signs of systemic complement activation. However, subjects at risk for future RA do not. Individuals develop autoantibodies and or ACPA and or rheumatoid factor positive approximately 3 to 5 years prior to the development of early RA. Synovium plays a crucial role in the pathology of RA. However, our knowledge of correlations between the complement gene expression and disease activity score 28 in early RA is lacking. Recently, transcriptional endotypes linked early RA synovium with three distinct pathotypes, namely lymphoid, myeloid, fibroid, and fibroid. However, it is unknown what might be the drivers of these three pathotypes. Here we will explore the level of complement gene activation and engagement of specific pathways and effector mechanisms in the synovium from early RA individuals. There were two main goals of this study. The first goal was to evaluate complement gene expression related to three complement pathways versus DAS28 by revisiting PEAC Cohort website regarding a comprehensive RNA sequencing analysis of the molecular pathways that drive early RA progression in the synovium and comparing with matched peripheral blood RNA sequencing in a large cohort of early treatment naive patients, namely the pathobiology of early arthritis cohort. Our second goal was to determine and quantify at the same time using 8-color multispectral immunohistochemistry and imaging analysis of various complement proteins based on the gene expression in the synovial baskets obtained from accelerating medicine partnership early RA patients using Vectra Polaris system. This table shows the correlation between DAS28 and various complement genes. For example, here C2, FcN, and FcγR3, complement factor B, and complement factor P, all these shown in a blue color, these were positively and significantly correlated only in the synovium based on the adjusted P values, but not in the blood. On the other hand, complement genes such as correlated, C5 and C6 shown in a red color, these were negatively correlated with DAS28, again in the synovium based on the adjusted P values and not in the blood. This slide shows the correlation of complement factor B gene expression and DAS28 from all 90 patients. And there was a positive correlation based on the adjusted P values, and this correlation was only in the synovium but not in the blood from all 90 patients, indicating the activation of the alternate pathway of the complement system at very early stage of the disease. Then we ask the question, which specific pathotype of the early RA synovium express high or low level of complement factor B genes? And here we found out the fibroid pathotype, which is very early pathotype, also known as immune passive pathotype, express very low level of complement factor B gene as compared to the lymphoid and myeloid pathotypes, again in the synovium, and we have not seen this type of any statistically significant difference in any of these pathotypes in the blood, again confirming that the involvement of the alternative pathway of the complement system at very early stage of the disease. We also found that complement C5 gene that was negatively correlated in all 90 patients. And this observation is very interesting because complement C5 is the therapeutic target for many inflammatory diseases, including rheumatoid arthritis. And we found that the correlation was negative only in the synovium, and we did not see any correlation based on the adjusted P values in the blood. We also found out that DAS28 was also correlated with various complement receptors, proteases, and regulatory proteins of the complement system. Here, for example, C3AR1, C5AR1, and CR1, these shown in a blue color, these were positively correlated with DAS28 based on the adjusted p-values only in the synovium but not in the blood. On the other hand, MAS1, complement factor H, and CD46, these were negatively correlated with DAS28. And also we found out that complement factor H related genes, they were neither correlated with DAS28 in the synovium nor in the blood. The top 3 line graph shows the complement receptor gene expression from all 90 patients. Here we found out that C3AR1 and C5AR1, these were positively correlated with DAS28. And interestingly, these data are consistent with our mouse models of arthritis, where we have shown that mice lacking C3AR1 or C5AR1, these were protected from disease. On the other hand, that we have found no correlation between DAS28 and the second core receptor for CA, known as C5AR2, with DAS28. Again, these data are consistent with our mouse models of arthritis, where we have reported that mice lacking C5AR2, these were highly susceptible to disease. And the bottom 3 line graphs show the correlation between DAS28 and among 3 receptors, and there was no correlation in blood from all 90 patients. After 6 months of treatment or the therapy, we also analyzed the correlation between delta DAS28 and various almost more than 50 complement genes. Here we found out that specifically a complement gene, a complement factor H later 4 gene, that only in the synovium that was highly and positively correlated with delta DAS28. What this means that the higher the baseline complement factor H later 4 gene expression, then the worse the outcome of the disease after 6 months. On the other hand, we found opposite correlation regarding CR1. Based on these interesting observations, we measured the absolute levels of complement factor H related 4 proteins in the sera from a different cohort of 88 patients. Here we found out that there was no statistically significant difference comparing healthy control early RA patient and differentiated RA patient regarding the absolute levels of complement factor H related 4 protein. And also there was no difference in the ratios of complement factor H to complement factor H related 4 protein. In order to find out the answer for second specific goal, we examined 23 synovial biopsies from early RA patient and the synovial biopsies were obtained from these patients, early RA patient, by using ultrasound guided methodology. And the 6 to 8 synovial biopsies were obtained from each patient, and the size of the biopsy was from 0.5 millimeter to 3 millimeter. Then these synovial biopsies were fixed in the formalin, followed by processing and histopathology by using hemotoxin and eosin staining. And we also examined the percentage of cells expressing almost 7 different complement proteins at the same time in the early synovial biopsies by using multispectral immunohistochemistry. This particular composite image shows the presence of all complement proteins. Predominantly C3C was present in this particular biopsy, which is shown in a red color. And also we found complement factor H related 4 protein was present, which is shown here in a magenta color, and complement factor H protein was also present. Interestingly, complement factor B protein was present in the subsynovial lining area, which is shown here in a pink color in a large amount, and it was present in the fibroblast. Again, these data confirm that, consistent with the complement factor B gene expression, that there is activation of the alternate pathway of the complement system at very early stage of the disease. We also found that complement factor H and complement factor H related 4 protein, these 2 proteins, they coexist in the vicinity of each other, specifically in the subsynovial lining area. Interestingly, both of these proteins, they counter-regulate the alternate pathway of the complement system. We also found that complement factor B protein was present also in the vicinity of both of these proteins. Again, these data confirm the involvement of the alternative pathway of the complement system at very early stage of the disease. We also examine the synovial complement proteins present in the synovial lining when the synovial membrane is at a very single cell disease. Here, single cell, and this means the cells are not dividing, and this is very early stage of the disease. In this particular stage, we found that in the synovial membrane, that complement factor H protein was present, most probably protecting the synovial membrane from the attack of immune complexes. And we have also confirmed that at this very early stage of the disease, by using multiplex immunohistochemistry, the cells present in the synovial membrane, all these were macrophages, which is consistent with many other studies. Due to the heterogeneous nature of the disease, not all biopsies were same, and in a little more stage of the advanced stage of the early RA, but we found that in the synovial membrane, when it was multi-layered, and we found that more C3C was present, which is shown here in a red color, but in the subsynovial lining area below this, we have found more complement factor H protein was present. So there was an imbalance of both of these protein, little more advanced stage of the early RA. In this way, we examine the percentage of cells expressing these 7 complement proteins from early RA, 23 early RA biopsies, and we found out that there was no statistically significant difference in the percentage of cells expressing complement factor H and C3C. And on the other hand, complement factor H protein was present, expressed by more cells as compared to the cells expressing complement factor H related 4 and complement factor B protein. And most probably this is true because both of these protein, they are present in a smaller amount in the circulation. We also found that MBL2 was present statistically significantly higher expressed by cells as compared to FcγR3, again confirming the involvement of the lectin pathway at very early stage of the disease, which is consistent with our hypothesis that lectin pathway is involved in the initiation of the this particular disease. And the bottom graph just shows the percentage of cells expressing all of these 7 complement proteins from 20 individual 23 biopsies. Finally, the conclusions: positive correlations of complement factor B and other gene expression in the synovium with DAS28 in early RA consistent with a prominent role of the alternate pathway at very early stage of the disease, consistent with our mouse models of arthritis. An inverse correlation between C5 expression and DAS28 in early RA synovium compared with blood provided evidence regarding failure of C5 directed clinical trials in RA. Correlation of a higher complement factor H related 4 gene expression at baseline in the early RA synovium with clinical outcomes suggest an unanticipated role for complement factor H in disease pathogenesis. Multispectral immunohistochemistry of the early RA synovium although shows an increased levels of both C3C deposition and factor H protein levels. However, a potential regional imbalance of these two proteins appears within the synovium that may contribute to the disease pathogenesis. All of these authors, they are involved in this particular study related to early RA. Finally, I would like to extend my sincere thanks to Dr. Michael Hollers for providing tremendous support for these studies, and also to other faculty members who have provided synovial biopsies from early RA patients, and also to Pitt Jallis from UK who have provided some of the synovial biopsies from early RA patients, and to Dr. Paul Morgan who have provided us ELISA method to measure the absolute levels of complement factor H related 4 proteins from the sera of patients, and also provided antibodies for this particular protein. Of course, to the NIH for the funding of this project for the last 21 plus years. And thank you very much.